Probably the most detected complication is twin-twin transfusion, because that's the commonest of the complications of monochorionic pregnancies. But the thing that I worry more about, honestly, with radiologists looking at twins is the determination of chorionicity. Because we get patients all the time who've been scanned and they know they have twins, they don't know what type, and that is what's critical. So if you don't look at the chorionicity, you won't think about the complications of it. And twin-twin is the most important one to detect because it can be treated successfully now. Be compulsive. First thing, chorion. How many placentas do you have? If you only have one placenta, then you need to look at your fluid next. And it's whether the fluid is symmetric around the two fetuses or not. If you have only one chorion and only one amnion, then you have to be even more compulsive about looking at the fluid, because the development of too much fluid in a monoamniotic pregnancy is also a heads up for twin-twin transfusion, which again can be treated if diagnosed. Very few in the dichorionic world, which is where both fetuses have their own placenta. In the monochorionic setting, twin-twin transfusion is going to be by far and away the commonest source of referral. Then the twin reverse arterial perfusion is, depending on how big the trapped fetus is, may be treated. And occasionally they will offer intervention when you have twins and one twin has a very, very small portion of the placenta, the selective growth restriction, where that fetus is at such a high risk of dying and causing compromise to the other that they will actually laser the connections between those two fetuses to protect the normally grown fetus from the consequences of demise. So that would probably be the commonest three indications.